Right now, the UK is in the middle of a heat dome. Temperatures this week are forecast to push past 35, maybe even 38 degrees centigrade. That could break UK's all-time June record. And every year when this happens, I see the same thing in clinic. People who didn't realise just how dangerous heat stroke can be until it was almost too late. I'm Dr. Ravi Gowda. I'm a consultant in infectious diseases and travel medicine here at health clinics in Coventry. In this video, I want to talk you through exactly what heat stroke is, the warning signs to watch out for, and most importantly, what to actually do if you or someone near you starts showing symptoms. This isn't meant to scare you. It's so that you know what to do calmly and quickly if it ever matters. Let's start with the basics. Heat stroke happens when your body's core temperature climbs to 40 degrees centigrade or higher, and your body just loses its ability to cool itself down. Normally, your body's very good at this. You sweat, your blood vessels widen, and you naturally slow down. But in the extreme heat, especially with high humidity, those systems can get overwhelmed. Here's an important distinction. Heat stroke is different from heat exhaustion. Heat exhaustion is your body's warning system. It's unpleasant, but if you cool down and rehydrate, you'll usually be fine within half an hour. Heat stroke is what happens when that warning system fails. It's a genuine medical emergency, and it can affect the brain, the heart, and your kidneys very quickly. This isn't just a problem for people on holiday somewhere hot. With this heat dome we're experiencing right now, this is very much a UK problem this week in towns and cities you know well. So how do you actually know if it's heat stroke? Here are the symptoms. Some of them are obvious, but a couple of them might surprise you. So there are about 10 things to watch out for because it's easy to get caught out. First, a core body temperature of 40 degrees centigrade or above. That's the clinical definition, though obviously you won't always have a thermometer to hand. Second, hot red skin. The skin often feels hot to touch and looks flushed. Third, and this one surprises people, not sweating. In classic heat stroke, the body's cooling mechanism has actually failed, so the skin can feel rather dry instead of being drenched in sweat. If someone's in extreme heat or they're not sweating, that's a red flag, not reassurance. Fourth, confusion or disorientation. They might seem not quite themselves, say strange things, or behave oddly. Fifth, slurred speech, like they've had a few too many drinks, but without the drinks. Sixth, loss of coordination, stumbling, unsteady on their feet. Seventh, a severe headache that comes on quickly. Number 8, nausea and vomiting. Ninth, a rapid, strong heartbeat as the heartbeat works overtime trying to cool the body down. And 10th, in the most severe cases, seizures or loss of consciousness. Now, you don't need all 10 of these to be worried. If you see confusion or slurred speech or unsteadiness, particularly in hot conditions, that's enough. You need to act quickly. So you've spotted the signs. What now? Well, I'll take you through the steps that can make a big difference while you're waiting for expert help. This is the part I really want you to remember, because what you do in the first few minutes might save a life. The single most important thing is call 999 first, and then start cooling them down. Don't wait to see if they improve. Heat stroke is a medical emergency, and without treatment, organ damage starts within minutes. So the very first thing is always call 999. While you're waiting for the ambulance, here's what you can do. Get them into shade or somewhere cool straight away. Remove any clothing that isn't necessary. Cool them down as fast as you can. cold, wet towels on the skin, especially around the neck, the armpits and the groin, where you'll cool the blood the fastest. If there's a cold shower or a paddling pool nearby, use that. Also, you can fan them to help the water evaporate and pull the heat away. And one important caution, if they're confused or losing consciousness, don't try and give them anything to drink because they might choke. I know it feels instinctive to want to wait and see if someone comes round, but you shouldn't. Heat stroke can escalate fast, and the earlier proper treatment starts, the better someone's chances. Let's talk about those most vulnerable and what you can do to help protect them. While heat stroke can affect anyone, some people are considerably at higher risk, and it's worth knowing who they are. First of all, there are young children under 5, because their bodies heat up faster and they can't always tell you how they're feeling. Then there are adults over the age of 65. The body's ability to regulate temperature naturally declines with age. Think about people with long-term health conditions like heart disease, diabetes, or kidney problems. And also anyone on certain medications like diuretics, blood pressure tablets, and sometimes people on psychiatric medications, because that can affect how the body handles heat. Think about pregnant women and people with limited mobility or learning disabilities who might not be able to move themselves somewhere cooler or communicate that something is wrong. If you know someone in any of these groups, this week is a good week to check in on them. A phone call, a knock on the door, just to make sure they're managing okay in the heat. Treatment is obviously vital, but prevention can keep them well, and that's exactly what you'll need to do to protect your vulnerable loved ones. The good news? Heat stroke is one of the most preventable medical emergencies there is, if you know what to do. Here's exactly what I'd tell my own family to do this week. First of all, stay hydrated, drink cool fluids steadily throughout the day, even if you feel thirsty. Avoid being in the direct sun between 11 a.m. and 5 p.m. when it's at its most intense. Try and wear loose, light-colored clothing to reflect the light. Find shade or air conditioning during the hottest hours. Go easy on the alcohol and caffeine. Both can make dehydration worse. And never ever leave kids or vulnerable adults in a parked car, even for a few minutes. And at home, close curtains on sun-facing windows during the day and create a through breeze by opening windows on opposite sides of a room in the evening. Heat stroke is something we should all take seriously this week, not just abroad, but right here at home. Know the signs, act quickly, and look out for the people around you who might be more vulnerable than you are. If you're heading abroad later this year, it's worth remembering that heat is just one of the health risks travel can bring. There's altitude, there's infectious diseases, there's the question of whether vaccinations are important before you go. That's exactly what we help with here at Health Clinics. Our travel health and vaccination service can make sure you're properly prepared, whatever your destination. You'll find the link to book in the description below, or just search Health Clinics Travel Vaccinations. So please stay cool, stay safe, and look out for those who might need your help this week. Thank you.